Hey, you guys, we're going to talk about cancer today. This is going to be one of those topics, again, where we're going to do one of these brief, very, very brief overviews. Because of the fact that cancer can mean so many different things in so many different parts of the body, in other words, it's not a single condition, this is going to be a little bit of a tougher one to talk about. And there's going to be a couple reasons why it's tougher. Number one, many of us, either ourselves or our loved ones, have been affected by cancer, and their experience is probably unique to their type of cancer. How severe it was. We'll talk about how we categorize cancers and how we talk about the severity of them, that kind of thing. But we're not going to get into the personal experience of it as much. And that's the stuff that I really would like to get to, but we're just not going to get to cover that in the book. And part of it is because it would take so much time to talk about the various ways in which people experience the kind of cancer that they have. Depending on all kinds of factors. So we're going to talk about some of those factors. But if this is a challenging one for you, just know that it's going to be brief. And we will, this shouldn't be a long lecture at all. Okay, so we already mentioned that cancer is not a single condition. We'll get into that, what that means in a little bit. Tumors. Tumors are one of those things that can be cancerous, but not necessarily. Many of us have had a family dog. My dog right now has tumors underneath her leg. And we went and did a biopsy, and a biopsy is a procedure you'll learn from the book where they just take a needle, go in and grab some cells, and then test them. That's essentially what a biopsy is. Tumors can either be benign or they can be malignant. In other words, they can be non-cancerous or they can be cancerous. The important thing to know is even if a tumor is not cancerous, that doesn't mean it won't cause a problem. It can still be problematic. In other words, if you have a tumor in your brain, it could be putting pressure on other parts of the brain. Even if the tumor itself is not cancerous, it could still be problematic. So it's still something that we don't want to have happen. But sometimes you get tumors that just aren't even a problem at all, and you just kind of let them sit there, and it's not a big deal. So this is another thing that makes it difficult to talk about things like this, because it could be problematic and it can be scary. Like the word cancer just sort of brings all these images of fear up in many of us. And sometimes they're just not a big deal, but depending on the kind. So that's what we're kind of talking about today. A little bit of the science. I'm not going to go deep into this, as we have not done in the past, because I'm not a scientist, or at least that kind. Maybe a social scientist, you call me. But cancer cells develop when alterations of DNA occur in regular cells. In other words, remember that stuff about cell replication? One cell turns into two cells. Well, there's a control system that monitors how fast cells replicate and what they do when they replicate, or what kind of cell it gets turned into. When that control system essentially breaks, quote unquote, then the cells can replicate faster, and they can do it in places that they don't belong, or become cells that are sort of misbehaving, in other words. So that's what a cancer cell is. It's just a cell that's just not following the rules, essentially. The more virulent cancer cells are described as anaplastic, just a little bit of terminology for you. And the movement of primary cancer site to another body part is called metastasis. We'll revisit that word in just a second here as we talk about staging. There are several different types of cancer. So the different type of cancer can affect potentially different organs in different places of the body. And so this is going to get confusing fast, but we're just going to kind of, remember, skim the surface. Carcinoma refers to epithelial cells. These are cells of like some parts of the skin, some membranes inside of our body, like in our intestines and that kind of thing. A sarcoma, which generally refers to bone, muscle, or connective tissues. Connective tissues can kind of be thought of as membranes as well, sort of, but I'm not going to get into the science of it, but it's just a very specific kind of cell that has a specific kind of function. Lymphoma is a cancer of the lymph system. We talked about the importance of the lymph system in the last chapter. We talked about immunities and immunodeficiencies and that kind of thing. That'll be an important factor here as we move forward as well. Leukemia is cancer of the blood cells, which of course tends to probably not stay in one part of the body because blood moves all over the body. And then melanoma is something that we all have probably heard of if we have ever been to a tanning bed, or we resist putting on sunscreen in the summer, which I'm kind of one of those guys that grew up never wearing sunscreen. I'm having to revisit my bad habits, I guess, that I learned in childhood. Okay, let's talk about staging of cancer. So there are several different ways of talking about this. Because, of course, we just talked about blood cancers that can move all over the body, and some cancers stay in one particular area, like in the bones or in the brain or something like that. We have to have different ways of talking about its sort of spreadability, essentially, or where it lives. In situ refers to cancer cells remaining superficial in tissue it originates in. In other words, it kind of stays in one place and isn't really doing much. Localized means that it's limited to the organ in which it originates, and there's no evidence of spread. It might be malignant, it might be cancerous cells, but it doesn't mean it's spreading to other organs or other areas of the body. Regional, spread to nearby organs or lymph nodes. Distant, spread to distant organs or lymph nodes. And what regional or distant means kind of depends on the kind of cancer. In other words, if it's the kind that typically stays in one place but is not doing that, then you might have a different way of talking about it. But if it's one of those that spreads quite a bit, the differentiation between those two terms is important, but not something that we're going to dig into very, very deeply. And then unknown is, of course, if you don't have enough information, you can't know where it is, where it lives, and where it's going. There are several different ways of talking about this. A lot of us just generally know this sort of general stage stuff, like stage 0, stage 1, stage 2, stage 3, stage 4. The general rule here is that the higher the stage, the more problematic it's going to be, the more threatening to life and the pursuit of it it's going to be. In other words, the higher the number, the more extensive. There's that word again at the bottom here, metastasis, that refers to the spread. So the more it's spreading and the faster it's spreading, stage 4 cancer refers to that. There's this other sort of notation stuff. So if you're a person who's going to work in a setting where there is a medical team, and if you're working with cancer patients, it might be helpful to know the medical terminology here. So TNM. T stands for tumor, N stands for the node, and M stands for metastasis. Again, that refers to the spread. Okay, node refers to the lymph nodes that it might be affecting. A 0 with any of those letters before it means there's no evidence. Let me start this again. A T0 means there's no evidence of primary tumor. An N0 would refer to no evidence that the cancer is affecting a lymph node, and M0 would refer to no evidence of spread. So the 0 is kind of the important part that we're talking about here. If you see an IS after the letter, that means there's a tumor in situ. Remember, that's that it's not that it's benign. It's localized. It's staying in that same place. It's not really affecting anything. It's just kind of remaining there superficially. And then T1 through T4 refers to the size or the involvement or how much effect it's having on that place. N, as it refers to nodes, and the 0, the IS, the T, those things can all be used for different letters here. The 1 through 3 refers to level of involvement of the lymph nodes. So how much involvement there is essentially tells us how much it's affecting the lymph system, which is sort of the body's immunodefense to the cancer spreading of cancer cells, that kind of thing. And then M, of course, is the metastasis. There's that word that refers to spread. Okay. If there's an X behind any of those letters, it means we just don't know. We can't determine. So it's just kind of like that simplified notation that you might see in medical record that can help you understand what kind of cancer it is and what you're dealing with. The reason this can be helpful for counselors to know this kind of stuff is if you're working with cancer patients, you can help patients and families understand the potential risks, the severity, in ways that sometimes some doctors are excellent at doing this and some of them are not so much. Just like some counselors are excellent at explaining different conditions and some are not. So this can be one of those skill sets that if you pick it up, you can work with this population in a way that's more useful and more helpful because you can understand what this means for them. Because that cancer stuff brings, just the word cancer sort of, you guys tell me what you think about this. This is what kind of discussion we might have in classroom. Cancer brings up, for me, both images of fear, like, oh my gosh, what does this mean for me? Is this life-threatening, or is it something I'm going to have to do chemo with, and I know a little bit about that. People lose their hair, and that's, potential embarrassment and just frustration, and then side effects and all that kind of stuff that comes up with it. It also brings up images of strength and courage and bravery and all that kind of stuff. And so these are the things that counselors can work with. And when somebody gets a diagnosis, depending on what kind of cancer it is and the severity that we can learn from this kind of thing, we can say, okay, let's talk about end of life, or let's talk about this is the beginning of your new life. This is sort of a wake-up call from all the behaviors that you're engaging in. So all kinds of reasons why coping responses this might bring up. So that's how this stuff can be potentially helpful. One more thing before we move on. When we talk about coping strategies at the very beginning of the semester, like denial, well, let me say this again. This, like many of the conditions we've talked about in the class, one of the ways we can think about them is through the process of grief or the potential of loss. People get the diagnosis of cancer and they're like, loss of life, meaning potentially existential issues of, fears of death and that kind of thing. Loss of time. I'm running out of time and I have to tick off my bucket list. I have to take care of all the things that I was supposed to before. I need to love my family better, and I need to do all these other things more meaningfully, and I need to stop behaving so poorly to myself, and these kind of things are what these can bring up. And so if we understand our coping mechanisms, if we can look at these conditions, especially this one, through the sense of loss, if we can understand a little bit about end of life kind of things with this condition particularly, not so much with some of the other ones, but what people experience when they face their mortality, these can be parts of the skill set that will help us handle this stuff better. What we're talking about now is we're just talking about the medical notation so that we can work in a treatment team and then do our job, which our job is that how do we cope with death? What is our coping mechanisms? When are they appropriate? When are they not? That's the kind of stuff that we as counselors get to work through. So anyway, hopefully that puts us into a little bit of context. As far as management, there's just so much to know here and so many different treatments that we're just going to cover the basics again. The generic goal of management, the generic goal of dealing with cancer can mean a couple different things. One, you could say, is there a cure for this particular one? Like, if we go in, cut out the tumor with a scalpel, will that cancer completely go away? Maybe. That's one potential goal depending on the type of cancer. Extension of life, meaning this cancer is going to be here, we can't do anything to stop it, but we can slow it down, give you more life to live, extend your life. There's also prevention of metastasis or prevention of spread, or the word palliation. So some of you have heard of like palliative care, that kind of thing. Palliation means that we can't necessarily, well, let me read this. We'll read this directly out of the book here. Palliative therapy is directed toward the relief of manifestations or complications of cancer, such as obstruction or severe pain, rather than toward a cure. In other words, we can't stop it, we can't fix it, but we can make your life more comfortable. This is one of the more difficult places to live because people are going to hurt and they're going to suffer. And this is where us as counselors can hopefully help sort of maintain some quality of life, build some meaningful experiences in life as their cancer progresses, particularly with the patients and families. So this is true of general counseling in general. Sometimes people are going to live with their conditions. If they have schizophrenia, if they have PTSD, if they live with anxiety, and they're always probably going to, then we say, well, how do you live your best life despite this condition being present? Some people say, well, can we cure my depression and make it go away? Sometimes maybe. Can we cure my schizophrenia and make it go away? We don't know how to do that right now. Who knows if we will get to that place. Medications are oftentimes a form of palliative care, which means that we can manage the symptoms. Counseling sometimes is relief of the intensity of symptomology, and sometimes it means let's see if we can make this stuff go away. It really depends. So the way in which we talk about this cancer, we're not really great at talking about psychiatric conditions in the same way. I suspect we'll probably get better at this over time, but we can think of palliative care as something that just reduces suffering, reduces pain. That's the idea here. Um, okay, getting back on track. Some individuals may forego some interventions due to risk or side effects. I put the word discuss, and class will probably discuss this, but I mean, there are so many reasons for this. Some people would prefer homeopathic remedies. Some people would just say, you know what, I've suffered enough and I don't want to go through this anymore. The treatments, yes, could keep me alive, but I'm ready to go. I've made my peace. Some people might say, well, let me try this other more experimental form of treatment that's not really been uh, approved yet by somebody or hasn't been tested on a whole bunch. There's all kinds of reasons why people might say this kind of intervention is not for me. Same thing goes in counseling. I really love this person-centered stuff where somebody is such a good listener and they are empathetic and they can feel with me and all that kind of stuff. But I need specific homework. I need tasks to do. I need the sense of my goals and where I'm going and where I came from. Sometimes people want just this free-flowing, just feel with me kind of experience, and other people want structure and order, and they want to know their path. They want to be more assertive in their treatment, that kind of thing. So there's all kinds of reasons why, whether the diagnosis is cancer or whether it's bipolar, it doesn't really matter. Some people may want to engage in your interventions that you offer, or this doctor or that one, and others not. It's a big topic, and that's one that I would love to discuss with all of you if we have time to do so. Because of the different goals in managing cancers, there's different types of surgery as well. Sometimes there's curative surgery. In other words, like cutting out a tumor might be an example of that. Palliative surgery, which might sort of, I don't even know an example of what that would be, but it's just sort of reducing pain and suffering, essentially. And then reconstructive. So if there's cancer of a certain part of the body, reconstruction might mean sort of building back functionality of that part. If you have to cut out part of the intestine, then how do you reconstruct the intestine so it still works to some degree? Okay, some of the potential treatments. Most of us have heard of chemotherapy. There's lots of different kinds of chemotherapy. I'm not familiar with most of them, but can be, you can basically, by the way, chemotherapy refers to chemicals, and chemicals usually come in the form of medicine or medication. So that's kind of what we're talking about here. They can be taken orally in pill form. It can be ejected in liquid form. It can be taken by a catheter port, which is basically like a tube that goes into a certain place. Sometimes those tubes can be directed right and localized at a specific area. Sometimes it can go into the bloodstream and move all over. Different ways that can be done. They can be topical. They can go on the skin, potentially, like if there's a skin cancer, it can sort of soak in through the skin. Absorb is probably a better word to say there. The thing about chemotherapy is that, and this is something we all kind of know, is they can damage healthy structures. Those chemicals are designed to kill bad cells. They're designed to go in and destroy things or demolish things. That's how they work. And so they can also damage potentially sensitive cells in the process. Some of the more sensitive cells, like hair cells, that's a common one that we know of, is people tend to sometimes lose their hair depending on the medication. The word for that is alopecia. Some of us have heard about this on commercials where there's like a guy going, experiencing hair loss. And so you'll hear someone use the word alopecia. That's essentially what that refers to. The one thing to know, or to remind ourselves, I guess, if we're not in this mode of thinking, is that when people hear the word cancer, they're like, oh my gosh, this is going to be the worst. No chemicals. No, I don't want this intervention. No, I don't want this to happen to me, whatever. But some people don't necessarily experience the same side effects or maybe that many side effects at all and can go on continuing to live in their normal lifestyle. That can happen. The exception, though, is that when somebody is taking chemicals that are intended to sort of kill parts, the bad cells, and you can think about it this way. If you go in and you start messing with the body's natural immunofunctions, then there's potential for other viruses or bacteria to go in and sort of take advantage of that weak point. So the exception of like living that normal lifestyle is you have people who need to be more wary about colds and flus. In the age of COVID, this is something that has, I don't want to get into COVID too much now, but this is one of those things where you might be walking next to somebody at a grocery store and you don't know that they're going through chemotherapy at the moment and they have their mask on, and it's not necessarily a political statement to bother everybody else. But that's kind of where we're at in our world today. And we get to talk to people as counselors about how do you protect yourself, keep yourself safe, and then, because your life may depend on it. And then how do we look at other people while they're doing that as well? So this is, some of the work of what counseling can be useful for. Radiation therapy, or the introduction of radioactive material into the body, can be done via implants. It can be done with a needle. It can be done with little beads or seed-like things, essentially a pill, but it can be put in a certain place. Like when we talk about what's good for the body and what's bad for the body, chemotherapy, radiation, they're typically things that you wouldn't want to do unless you have to, right? The same can go of counseling. Sometimes people don't want to be in counseling, but the alternative is that you're suffering out in the world alone and you don't take on the care, right? Sometimes we talk about things like with EMDR, you wouldn't want to re-traumatize somebody by having them talk about their trauma. But that's true, maybe, but if somebody is repressing that trauma and it's causing these alternative side effects, then you have to go in, take care of the stuff, even at the risk of it being a problem. It's just like a surgeon goes in and he cuts a person open. Typically, you don't want to knife yourself open, right? That's not a good thing. But if the alternative is then the bad stuff stays inside, it can be a good thing for somebody, right? It's the same thing here, is that you don't necessarily want to take all these drugs. You don't necessarily want to introduce radiation into your body, but if the pros outweigh the cons, you might want to do that here. So this is kind of in the realm of what we're talking about here. Okay, moving on. I think we have. Yeah, we're almost done. Apparently, I left a blank slide at the end. You can color a picture on that. Draw a picture for someone you love and send it to them. I don't know. I don't even know why I'm saying that. It was an accident. Moving on. Immunotherapy is another form. Essentially, it boosts or stimulates the immune system. So remember last chapter we talked about the immune system and we said there are these T cells and they're the killers. They go in and they attack bad stuff. And then there's these B cells that they create antibodies to help kind of boost the immune system. So there are boosters, and there are killers, and there's all these different functions that it has. Immunotherapy can be a stimulant to the immune system. In some cases, you want to do that. Hormone therapy, it can be essentially the idea is to boost other therapies. Like, for example, if you're doing chemo and you're introducing some stuff that's going to kill the bad things in the body, but it might also kill the good things like hair follicles and that kind of thing. But then you want to introduce an immuno boost as well so that you can kill the bad stuff, but not the immune system. So you boost the immune system while you're putting in all the bad stuff. You can see how complicated this can get. Essentially, hormone therapy can decrease the spread. That's part of the way it's used. Monoclonal antibodies, very similar to what I was just talking about, just a different thing. I don't know how they work, to be honest. I don't understand that one at all. But it's a little bit in your textbook and require a little bit more learning from me if I wanted to really dig into that one. Gene therapy, another option. Bone marrow or stem cell transplant. This is another one of those issues, just like we were talking about COVID just a little bit ago. Politicized because of the stem cells and how it's talked about in the conversation about abortion. This is one of those places where you guys get to have these debates on whether the science outweighs the morality, that kind of stuff, or vice versa. But this is an option. When there's potential life-threatening disease or disorder, then this is one of the ways that we can deal with that. Essentially what you're doing is, remember from the immune chapter on the immune system, bone marrow is the site of our white blood cell, of where white blood cells are developed, and it's an important part of our immune system. If that part needs to be boosted or is not working or there's a potential problem, then a bone marrow transplant can be an option. In other words, it can increase the immune system's response that might be affected by things like chemo or radiation. So in other words, if you're going to introduce chemo to attack something, but you need more white blood cells to go in and kind of boost it up or replace what the chemo is counteracting, this is one of those options. One of the hard things about this, and why you can imagine this is so challenging and difficult, similar to the context we were just talking about, going into a person's trauma, reliving it, reopening it for the benefit of potentially sort of getting over it or working through it or healing parts of it or whatever. What we're talking about here is that you weaken the immune system to decrease rejection. So imagine this. You have some bone marrow from an outside source, and the body is built so that it says, do not let that outside stuff in. We don't want foreign substances in our body. We don't want foreign materials. So then you have to go in and you have to decrease the immune system's response. You're sort of dampening it so it can't recognize this foreign stuff. It goes in, and then hopefully by having this weakening the immune system, so you introduce foreign bodies, and then once it takes hold, it's not rejected, then the immune system sort of flourishes, hopefully exponentially, right? So you weaken it in order to strengthen it. In counseling, we do the same thing, as I've been kind of telling you. Sometimes we ask people to talk about painful things in order for them to be able to handle or have capacity to handle more painful things in the future. It's kind of the idea. Same thing here. We don't have a great sense, I don't think, of how our psychological world, our mind, our inner experience, however you want to talk about this, the psyche, there's all kinds of ways to talk about it. But we don't have a great understanding exactly of what the mechanisms are. Freud did a lot of good to help us figure that out, but we still are a little bit in the dark as to how that works. By the way, so are physicians. So are medical scientists. Sometimes you introduce something, you say, I don't know exactly how this is going to work, but we know that it has benefit as well as detriment. There's pros and cons, there's going to be consequences, but we think it's for the ultimate good. We may not know exactly what mechanism the psyche is using to repress painful experiences, but we know if we bring it back up, we can maybe learn about that or find out a little bit more about that. That's kind of the idea here. So that's it. I will leave it there, and I will talk to you guys again very soon. See ya.